Hi, this is Jenny Johnson, Shoemaker Proficiency Partner, CIRS coach, consultant, and patient educator. We are going to talk now about how CIRS is diagnosed. So we'll start with the CIRS screening process. This is kind of the poor man's diagnosis, or sometimes takes place before the formal diagnostic process. It really depends on the preferences and kind of the timing of when you get in with a clinician and what their preferred process is. But just wanted you to know what the screening process is in case your clinician refers to it. This includes a symptom cluster analysis, which we have talked about in So You Think You May Have CIRS, and in What is CIRS and How Does It Happen. I'm going to show you the chart in the next slide in case you're not sure what I'm talking about. But if you have 6 to 8 positive colored boxes, or your clinician might have it more marked out as a checklist. But if you have a certain number and certain type of symptoms that your clinician will help you determine, then that is step 1 of the screening. And it's actually 4 to 5 of those positive clusters for children who are less than 12. So that is step 1 of the screening. Step 2 is the visual contrast sensitivity test. This can be done in your clinician's office if they prefer to do it that way with a handheld unit. If you're working at a distance with them, or if you've already done this online, it can be done online on your device. It is just $15 at survivingmold.com, and it gives you the instructions to follow to how to do it properly. And if you fail this test in either eye, it is considered positive for biotoxin illness. So that is step 2 of the screening process. If you also have known or suspected exposure to biotoxins, which is not difficult given that 50% of water damaged buildings are thought to be water damaged, but your clinician will probably want to ask you for, medical history of if you've eaten certain types of fish lately, where you've traveled, where you live and work, and the history of your building, or maybe you've even had an inspection or you've done a dust sample. But if you have known or suspected exposure to biotoxins, that's really the third aspect of this screening process, which if all 3 of these yield a yes or a positive, you've got a 98.5% chance of having CIRS. So this is a really, really fantastic screening tool. Now, the formal diagnosis, I'm sorry, here's the symptom cluster chart that I mentioned. Wanted you to have another visual of this, even though I did include it in previous videos. This is the symptom chart that you may be doing your symptom cluster analysis from. And so you would go through and circle the different symptoms that you have that are not due to other known medical conditions. And then the clusters are these different colored boxes. So you would count up the different clusters that represent your symptoms. And again, 6 to 8 different clusters is considered significant for adults and 4 to 5 for children. So let's talk about CIRS diagnosis. Once you are working with a Shoemaker clinician, and I did offer some instructions on how to find a Shoemaker clinician and what questions to maybe ask over the phone before committing to a clinician to make sure that your expectations are set properly for how their office works, and you get set up with a clinician that's going to be a good match for your expectations. They are going to take you through a diagnostic process, and it may differ a little bit from clinician to clinician, but I'm going to explain to you the 3 tiers of case definition for CIRS for the formal diagnostic process. So tier 1 is this. It includes a history of exposure to biotoxins. Again, that could be you've taken a dust sample or maybe an air sample, had an inspection, or you have water damage because it's sitting right in front of you. There's a flood, or you have a history of a water issue, or a tick bite, another route of exposure, route of entry of a biotoxin perhaps. And a doctor will ask you some questions to help drill down on what this exposure source might be for you. If you are local to your clinician, they will likely want you to come in for a physical exam if possible too. A lot of clinicians do offer virtual treatment, so they may be unable to do the physical component of their medical exam, but if you're local, that part is very helpful. The second aspect of the tier 1 case definition for CIRS is this presence of a multi-symptom, multi-system illness, as evidenced by 6 to 8 positive symptom clusters for adults and 4 to 5 for children. So again, going back to that symptom cluster chart, if you only have 2 symptoms, or if they're all in one cluster, you're either catching CIRS really early, or maybe it's something else going on. And so CIRS really is known to be a multi-system, multi-symptom illness. And so that part is key. And then the third part of tier 1 is differential diagnosis to rule out other diseases that could be the culprit for your symptoms. So your clinician will likely, through taking a history, maybe doing some labs, they're going to look and make sure it's not something else. So tier 2 of the CIRS diagnostic criteria involves doing some objective tests. So we've already talked about the visual contrast sensitivity test. That actually is one of the objective tests that counts towards the 3. We need to have 3 out of these 6 categories that need to be dysregulated to meet the tier 2 case definition of CIRS, in addition to tier 1. So perhaps you failed the VCS test. Perhaps you have a genetically susceptible HLA-DR. We talked about what that means in what is CIRS and how does it happen. So if you want to know more about what is HLA-DR, please watch that video to learn more. But if you also have the genetic susceptibility, and then if you just have one more of these biomarkers that is dysregulated, say it's TGF-beta1 or MMP9 or C4A, or MSH, if you have one of these that's listed in 3, 4, 5, and 6 below, or number 2, then any 3 out of these 6 categories that are dysregulated would meet the tier 2 case definition of CIRS. In 2008, the Government Accountability Office actually added a 3rd tier to the case definition of CIRS for formal diagnosis. So we need tier 1, we need tier 2, the objective biomarkers, and then tier 3 is that we need to see resolution with treatment. So we want to see at least 2 out of those 3 originally dysregulated biomarkers. We want to see at least 2 of them improve with appropriate treatment. And if they do, that's a sure sign that you do in fact have CIRS, or did. There are additional CIRS tests, I call them advanced CIRS tests, that some clinicians will do right off the bat. Some might not do it all for various reasons, or some may do at certain times along the way throughout your treatment. But I'm going to tell you what these are, just so that you feel equipped and maybe empowered for what could be to come. So there's the NeuroQuant MRI. This is a normal MRI of your brain with an extra software applied to the results to determine if your brain, certain regions in your brain are either hypertrophied, which suggests swelling, or atrophied, which suggests shrinkage. There are certain regions in your brain that might have this pattern of atrophy and inflammation that is classic for someone with biotoxin illness, and particularly with mold exposure. So having this MRI done can be very confirming that, yes, your brain looks like a mold brain on imaging, and it is fixable. It does not look like an Alzheimer's brain, or it doesn't look like the brain of somebody with maybe a TBI. This looks like a CIRS brain, and we can fix this. And ideally, if you've had one done early in your diagnosis or treatment process, having one done towards the end as you are nearing your full recovery or at your full recovery would be ideal, to make sure that your brain has recovered in all of those regions that may have been either atrophied or inflamed originally. We want to see that. And that is often covered by insurance. I didn't mention insurance with the labs, but the blood labs that are part of the Shoemaker panel of blood labs are often covered by insurance. So they are just done at LabCorp or Quest for the most part. Some of them might need to be handled differently and have a higher out-of-pocket cost, but a lot of them can be done with insurance coverage, and so that's fantastic. And the NeuroQuant MRI is often also covered by insurance. Out of pocket, it might cost about $500 if you have your physician give you a script and help you find an appropriate place to do it. So the next advanced CIRS test is Marcon's testing. And it's not so much that it's advanced, it's just not one of the initial biomarkers necessarily, but this is an essential part of your treatment process, is getting tested for this opportunistic bacterial infection that can take up residence in our nasal and nasal passages and sinus areas, or even in our dental cavitations where we've had wisdom teeth pulled out, or maybe old root canals that have gotten infected can develop Marcons, can even be vaginally found. So there are kits with swabs. It's very much like a COVID swab, and they can be ordered either by your clinician or by patients directly at Microbiology DX. And follow the directions to do the swab, or ideally have it done by a nurse or somebody at your clinic. And then you send that off for analysis, and you will find out if you do or don't have this opportunistic infection. And if you do, it's an important part of the treatment to have that addressed, because it is a biotoxin producer in and of itself. And it can really be an obstacle to recovery if you have Marcons and do not treat it. So that is one of the additional CIRS tests beyond the blood labs. And then number 3 is Genie. This is a newer test. It is a blood test, and this one is not covered by insurance yet. It's a little bit pricier, and so some doctors will encourage their clients to do it up front because it is so powerful. Others may delay it or may not even do it at all because of the price, and maybe patients don't need it because they're progressing as anticipated with their treatment program. Excuse me. Genie stands for Gene Expression Nanostring Information Explained. And it is using transcriptomics, which is another word for epigenetic expression or gene expression, that can help with diagnosis. It can help with a targeted and personalized treatment. And then it can help identify obstacles along the way. Again, if you're not progressing with your treatment as anticipated, the Genie can be done to identify what might those obstacles be. Those obstacles might be, well, you're reacting to actinomycetes, not just mold. Or it appears that you may have an issue with histamine going on. Or maybe there's PTSD at play. There are a variety of things that it can pull up that otherwise we'd be kind of like, running a whole bunch of other tests trying to figure out what are we missing, and the Genie can look at a lot. And it can determine where you are in your recovery process. So it's super, super helpful when it comes to personalized medicine. The Shoemaker protocol is already highly personalized. Each step is based on your lab results and your symptoms, but the Genie can personalize it even more and maybe even speed up your process. That is it for the diagnostic process of CIRS, and I hope to see you again in the next video, which will be what to expect with CIRS treatment using the Shoemaker protocol.